As a young child, I was very interested in playing sports, and naturally as I got older, playing football, basketball, track, I was always very active, and unfortunately a couple times in football took a big hit and had some injuries. I had to work with the physical therapist at school and the team physician. I saw how they treated me, how they got me better, got me back on the field. And as I got older and I realized I wasn't good enough to become a professional athlete, I thought I would do the next best thing and help treat athletes. Eventually that just led to treating people with all types of pain. After high school, I completed a biology undergraduate degree at the College of New Jersey. After that, I went to medical school at St. George's University in Grenada. I went to Georgetown University in Washington, D.C. and did 3 years of a physical medicine and rehabilitation residency. Then I moved again to a fellowship in Birmingham, Alabama in interventional spine and sports medicine. I think what I ended up realizing, certainly for a certain category of people, surgery is very necessary and needed, but surgery should always kind of be a last resort unless there's some sort of emergency or a very severe injury. What I liked about physical medicine and rehab and interventional procedures was I was the person that was a patient's last attempt at avoiding surgery. Somebody came in and they had tremendous pain and they thought that they were worried that they were going to need a big surgery. It gave me a lot of gratitude to find out that there were very simple, minimally invasive procedures that could get people feeling better without prolonged recovery times. While MRIs and X-rays and CAT scans are really important in figuring out where a patient's pain may be coming from, there are a lot of people that may have a disc bulge or a disc herniation and that might not be causing pain for them. So it's really important to not just focus on what a test shows, but also listening to people, listening to their therapists, their chiropractors, and getting a general sense of getting to know the patient and that specific person and treating their specific problem. What brings me great joy is when I have a patient come back and they tell me that they can pick up their kids again or go back to a sport that they played or activities that they thoroughly enjoy. As I said before, having experienced my own injuries and getting back to doing the things that I love to do, I know how important that is for people to ultimately enjoy life as much as possible.